Hello everybody, I'm Chiara from Spezieria Palazzo Vecchio and today I'm gonna talk about hypercholesterolemia and cardiovascular diseases. I would like to talk about it because more and more people suffer from hypercholesterolemia, which means a high concentration of cholesterol in blood. So let's introduce the main character of this disease, cholesterol, which is a fatty substance necessary for our body. It participates in the synthesis of some hormones and vitamin D and is a constituent of cell membranes. It is so important that we produce it ourselves. It is produced by the liver, but it can also be introduced with diet. It is contained, for example, in foods rich in animal fats such as meat, butter, cheese, egg, liver. On the other hand, it is absent in fruits, vegetables, and cereals. There is one important thing to remember, which is that nutrition has a very little influence on blood cholesterol values, between 10 and 20%, because what mainly affects cholesterolemia is the amount of cholesterol produced by the human body. This cholesterol is so important that must be transported, and the transport through the blood is entrusted to particles called lipoproteins. There are four types of lipoproteins classified according to density, which is inversely proportional to the amount of cholesterol present. The most important lipoproteins for cardiovascular prevention are LDL, or low-density lipoproteins. They carry cholesterol synthesized by the liver to other body cells, and HDL, or high-density lipoproteins. They remove excess cholesterol from different tissues and transport it back to the liver, which then eliminates it. Well, we speak of hypercholesterolemia when the total cholesterol, LDL plus HDL, is too high. Optimal levels are as follows. The total cholesterol should be up to 200 milligrams on deciliter. The LDL should be up to 100 milligrams on deciliter, and HDL should not be less than 50 milligrams on deciliter. Among these, the values to keep under control most of all are those of LDL, known in common language as bad cholesterol, because when they are present in excessive quantities, in fact, they tend to deposit on the arterial wall, causing progressive thickening and hardening. This process, called atherosclerosis, can lead over time to the formation of real plaques or atheromas that obstruct the blood flow or even block it completely. When heart does not receive enough oxygen-rich blood, angina pectoris can develop. Angina pectoris is a condition characterized by pain in the chest, arms, or jaw, usually linked with exertion or stress. In addition, the plaques can break off and form a thrombus, which can induce a sudden stop in blood flow. Depending on where it is located, the obstruction of a vessel can cause myocardial infarction in the heart, stroke in the brain, or intermittent claudication in the lower limbs. An equally serious complication that I would like to focus on is metabolic syndrome, also called insulin resistance syndrome. This is a dangerous combination of some cardiovascular risk factors which correlated to each other, and in the presence of blood values even slightly out of the norm, can give rise to a situation that poses a high risk of heart attack, stroke, diabetes, kidney, breast, and brain tumors. We speak of metabolic syndrome when at least three of the following risk factors here on the left coexist. There are several risk factors that can contribute to hypercholesterolemia, including diet, overweight and obesity, lack of physical activity, but also the concomitants of metabolic diseases such as diabetes, for example. For the record, to learn more about the role of diabetes on cholesterolemia, I recommend you to look at our previously made video about diabetes and hyperglycemia. Well, smoking can also damage blood vessels and accelerate the hardening of arteries. Furthermore, the level of LDL cholesterol tends to increase with age, especially among women. Stress should not be underestimated. It induces an increase in bad cholesterol, LDL, and because everything starts from our brain, especially from the hypothalamus, where two hormones are produced, cortisol and adrenaline, which serve to increase our energy. Specifically, cortisol increases the concentration of sugars, which, if not disposed, they turn into fatty acids and cholesterol. There are also individuals genetically predisposed to develop hypercholesterolemia and who can therefore develop atherosclerosis and heart problems from an early age. And this condition is known as hereditary hypercholesterolemia and is associated with a series of mutations in the LDL receptors gene. This gene, when not functioning properly, is unable to capture the LDL cholesterol particles and so doesn't allow them to be removed from the blood. So let's talk now about prevention. To limit as much as possible the cardiovascular risk associated with hypercholesterolemia, it is first of all necessary to follow a healthy lifestyle. Do not smoke. Observe a correct diet by reducing fats, especially saturated ones. Reduce alcohol consumption. Practice a little physical exercise, and to control hypertension and possibly diabetes. The dietary indication provided also must be applied in case of hypertriglyceridemia, because an increase in triglycerides exposes the body to a greater cardiovascular risk, especially if associated with hypercholesterolemia or diabetes. The food excesses, and in particular the intake of simple sugars, as well as alcohol, cause an increase in blood levels of triglycerides. Sometimes, however, lifestyle changes are not enough to keep cholesterol levels under control, and pharmacological intervention may be necessary. There are several categories of drugs that can reduce cholesterol, but there are also many natural remedies. We have the most common remedy is represented by statins, but as many of you already know, the synthetic ones or statin-based drugs have the side effect of lowering the level of coenzyme Q10, which is essential for the production of energy in muscle cells. For this reason, those who take statins can incur muscle pain or myopathies. And these side effects are significantly lower if you take natural statins. The most common is monacolin K, which is produced by the fermentation of red rice by the Monascus purpureus mushroom. Monacolin K blocks the enzyme involved in the synthesis of cholesterol. There is also another very important element is carnitine, which is synthesized by our body in liver and kidneys. It is composed of the amino acid methionine and lysine, and it acts directly in the fat's metabolism. It allows the conversion of fatty acids into energy. It increases blood levels of HDL, the lipoproteins used to counteract the increase in blood cholesterol. And now I'm going to talk about soy lecithin, which contain choline and inositol. Soy lecithin is a complex of phospholipids used for the treatment of the cardiovascular system and to rebalance the cholesterol levels in blood. In fact, it allows both to rebalance the HDL-LDL ratio and the solubilization and transport of cholesterol in the blood. Not only that, but it is also capable of lowering triglycerides. If you remember, triglyceridemia is a risk factor. These two actions, HDL and LDL rebalancing and lowering of triglyceridemia, are also performed by inulin, found in the artichoke, which, if you remember, we can also find among the remedies for diabetes thanks to its hypoglycemic action. Also, the circulation plays an important role. We have ginkgo biloba, which is able to promote blood circulation. In particular, it acts on the peripheral circulation, which means the circulation of the limbs, and also thins the blood, avoiding the formation of plaques. Well, we have distributed all these active ingredients within two of our products. The first is lipostatin, containing statin from red yeast rice, containing omega-6 to help fluidify blood, and containing also a Q10 coenzyme to integrate what is possibly and minimally destroyed by the statins, and so avoid the onset of muscle pain. It can be considered by those who take pharmacologic statins and want to replace them with natural statins. Obviously, before making decisions of this kind, print please the product sheet that you can find at the link on your left and show it to your doctor. The second product is soya lipid. It's suitable for those who want to keep both cholesterol and triglycerides levels under control. This thanks to the synergy of soy, artichoke, carnitine, and ginkgo biloba. Even in this case, consult your doctor before the assumption. That's all for today. Thank you very much from Spezzeria Palazzo Vecchio.